So from here to access her hips and her lumbar spine and her gluteals, I was teasing her before we went into session here. What I'm gonna do is I'm gonna unhook my leg and I'm gonna walk in. I'm gonna walk her right into my holster, right in here. Because now I can mobilize her hip just using my hips. How's that?
Good.
Good. Now, if I want to isolate, because you're going to see this, you see how this leg comes along for the ride? If I want to isolate, what happens if I anchor here and then lean in?
Whee.
Are you dead?
Ay, not yet. Holy moly.
I'm not dead yet.
Ay.
I'm not dead yet. So, is it too much pressure on the hand?
No.
Or is it the hips?
I mean.
Or
yeah,
the combination?
yeah.
Okay. So the reason I ask that, there's multiple things going on. I'm using her hips as a handle to get into there. Mobilizing her sacrum, mobilizing her pelvis, mobilizing her lumbar spine, opening some of that up, getting into gluteal muscles, particularly gluteus maximus. Here in a minute, you'll see this. And I'm using that to mobilize through the lumbar spine. Affects all of these structures. It looks inordinately simple from the outside, but the way it feels, I think, can be vastly different. What's going to happen here is I'm going to take her out of my holster and I'm going to bring her up and over into a big circle. Come around, big circle. How's that? Mm-hmm. So if you're working with somebody like Kristen and they're like, oh my God, can you be nice to me? Jeez, whew, I'm dying. What are you doing? Mobilization, back off of the compression. If they have chronic pain, typically you kind of go the other way. You're going to lean a little bit more towards compression, just generally speaking. So I'm going to bring her up and over. Now, when I go knee to opposite shoulder, that's a big gluteal stretch. That's a big stretch to gluteus maximus, Sir Mix-a-Lot's favorite muscle. Come on up and over. Now, I'm going to anchor knee to opposite shoulder. Anchor knee to opposite shoulder, and then add the hamstring stretch. We compressed the hamstrings before, now we're lengthening them. Now this is affecting her lumbar spine because of the way we're rolling her over. She likes this. She relaxed on me.
Yeah.
And then with the leg bent, I'm just going to roll her over, kind of a deep twist through the lumbar spine there. And then slowly help her unravel. Now I'm just going to switch legs. Quick leg sequence. That leg sequence is no different than what's an intro tie. The only move that's different is the one from the side at the beginning, that first one they show. So from here, again, I'm going to lift her leg up. I'm going to bring her to just past 90 degrees. She feels stiff on this side, especially compared to this one. Yeah. I'm going to sit my keister down, and generally speaking, ankle, knee, hip, and shoulder, one line. Leg is just going to be past 90 degrees. So I'm going to bring her just past 90, see if my leg is in the right position. If I wasn't close enough, I might have to scoot my keister forward. If I'm real tall and I got long legs, I might have to scoot it back. You're going to have to make little customizations based on the other person's body. So from here, I've got a good broad arch pressure into the hamstrings, and then slowly I'm going to get a grip here and I'm going to lean back and pull her into me. Not too much, Kristen?
No, I can strangely handle it way better on this side.
And it may be sore on the other. So again, my leg is lengthened. I'm pulling her into my foot. I'm leaning back, pulling her into my foot. Leaning back, pulling her into my foot.
Oh, hello.
So, because from the outside, it's like, yeah, big deal. How's it feel? Oh, yeah. Holy moly. Jesus, Jesus, Jesus. It's not really over until it's like gospel hour, until they're calling out to the good Lord. That's when the sessions get good.